Guys, if you are a newly licensed Medicare Advantage agent, you're preparing to sell Medicare Advantage, you're going to love this call. This is a real Zoom training that we're going to do. We're going to talk about some really basic stuff that all new agents are going to need. We're going to be addressing stuff like the donut hole. I love donuts. I don't know about this donut hole thing. The maximum out of pocket versus like catastrophic coverage. Great ways for like new agents to get out there and just start rocking and rolling. If you're like me, you may have 5 counties that you're working in. I mean, I've got a bunch of final expense clients that we're hitting, but throughout the 5 different counties, we've got all these different products. So we're going to talk a little bit about all of that. So let's just jump right into it. Guys, we have a very special guest on this call. Please let me introduce the amazing Luis Moreno.
Hey guys, glad to be here.
Awesome. Yeah. Excellent, Luis. So thank you for joining. So, if you could explain what this donut hole is to layman's terms. I mean, someone who has no idea what you're talking about. The donut hole, how it works, when it kicks in, all that.
First of all, I love donut holes. I don't know about you, man, but I go to the donut shop. I want some holes. They're easy. Pop them in and you're rocking. Okay, but that's not the donut hole that we're talking about here. Okay, so in the Medicare world, the donut hole is the dreaded donut hole. Seniors do not want to get into this donut hole. And what it is, it's on the prescription side of things, okay? So what happens is, and I'm going to do a little more detailed, but here's what it is in a nutshell. There's only a certain amount of money that a senior on a Medicare Advantage plan or a standalone prescription drug plan has. So they got this little bucket of money, and it's about $4,000 and change, and we'll get to the specifics here. And when they go buy a prescription, they're using that money in that bucket to pay for those prescriptions. Now, problem is once they use it, then what? That's where the donut hole comes in. So when that initial bucket of money is used, then they go into the donut hole. The reason that it is not a good thing in the Medicare world is instead of paying co-pays for your medications, you end up paying a co-insurance. You end up paying 25% of the cost of that medication until you fill this empty hole up. And we'll get into the details of that here in a few minutes, but that in a nutshell is what the donut hole is.
Okay, so it has nothing to do with like if you end up in the hospital for months. This is just the medication.
This is just on the prescription side of it. And I tell agents the engine, the mechanism of how this works, whether you're in an Advantage plan that has prescription drugs, or if you're in a standalone prescription drug plan, this engine, this mechanism that I'm talking about works the same. And it also works the same across all carriers. So you're not going to find a carrier that has a different limit. No. It is standardized across all carriers and across Medicare Advantage or prescription drug plans.
Okay, so yesterday I'm looking at a couple different plans. I've got a client who I'm going to be meeting with, and I'm thinking, let me see what the different carriers have for the options. And I started noticing something like there's this maximum out of pocket. One carrier it's like $2,400, another one's $3,400. But then I'm reading elsewhere about this separate thing called catastrophic coverage, which it kicks in when the client has to spend like a lot more money. So I'm confused. How is there a maximum out of pocket, and what is this catastrophic coverage? What is this?
Man, I tell you what, it's 2 different animals within the same Advantage plan. So let's tackle the catastrophic question first before we get into the maximum out of pocket. And just I'm going to do the maximum out of pocket. If you're wondering, that is a dollar amount that this senior will spend in a given year for medical, not prescriptions, for medical. Okay, and I'll talk about that here in a minute. But let's talk about this catastrophic. Let's get into a little more details on the donut hole. So I'm going to share my screen with you all so y'all can get an idea. Now, what I'm sharing with you right now, Doug, and your viewers, is a summary of benefits for one of my plans in the area. Okay. Now, this is the prescription where I'm on page 9 of 13. Let's see if I can make it just a little bit bigger without losing stuff. Yeah, I can. So this right here, guys, has to deal with my area, this one particular plan. Okay. Now, you'll notice here, Doug, there are 4 stages: stage 1, stage 2, stage 3, and stage 4. Whether you're in those 4 stages have nothing to do with, well, I've been more to it this way. All carriers have these 4 stages. Okay, I lost my train of thought. If you're in a prescription drug plan, you're going to have these 4 stages. If you're in an MAPD, a Medicare Advantage prescription drug plan, you're going to see these 4 stages. So, number 1, these plans all have stage 1. Now, here's where you're going to see some differences. Stage 1 is your deductible. Now, in this particular plan, this one has no deductible. But in other plans, you may see a deductible for tiers 3, 4, and 5. You may see a deductible for tiers 4 and 5. So you got to study the plans. You got to know your area, your carriers. So this right here it is a stage that everybody has, every carrier has, but the specifics on it, the deductibles are going to vary. And I just threw out some words: tier 1, tier 2. What is that? Okay. Medications are going to fall into one of these categories. Every carrier has a formulary, and that is their own list of medications that are covered. And every medication is going to get assigned a tier. So tier 1s are your preferred generics. Your tier 2s are your generics. Your tier 3 are your preferred brand name. Okay, we got this insulin program that I'll talk about here in a minute. Your tier 4 is your non-preferred drugs, and your tier 5 is your specialty. The only way to know where this particular medication is going to fall in is to do your research, pull up the formulary, or use the carrier's drug tool to figure out where that medication is. Now, you can do it on Medicare.gov. That's a government site. I wouldn't, but you could. We also have a program called Sunfire that all of our agents are given access to that will also help you determine where these tiers fall in for these medications. And it will even sort out the plans for you based on the list of medications you put. So it's an awesome tool. But so right now, Doug, deductible. So realize that every plan has a deductible. Now, we go into stage 2. When you are in stage 2, this is called the initial coverage. Think of this, Doug, as your little bucket of money. Now, the amount of money that you have in this bucket is down here at the bottom. Okay, it's $4,430. That's the amount of money that they give everybody that's on a Medicare Advantage plan or a standalone prescription drug plan. That is a standard. So you have this bucket of money, okay? Now, money sits there, and let's assume that you go get this medication, okay? And let's assume that this medication right here is a tier 1 medication. And you go to the retail pharmacy, or you do mail order, whatever, it doesn't matter. But you're gonna pay a $0 copay. Insured does not pay anything. Okay, but the cost of this is $100. That entire $100 is going to be removed from your bucket of money. So now, instead of having $4,400 in change, you're going to have $4,300 in change. Okay, now your senior, Doug, does not have to keep track of this. Your senior is they're going to receive every month an EOB. It's an explanation of benefits. And in that explanation of benefits, it's going to give them their running count, where they're at on this. Okay. Some agents like to do it. There's softwares that would do it for you and estimate when you're going to use all your money. I don't even get into that. I just let the carrier send them that explanation of benefits. Now, Seniors, when they're in this stage 2, these are typically very happy people. Okay. They're doing their thing and they're going to their pharmacy and they're picking up their meds and they're just happy as a senior can be. Now, here comes a problem. They go to Walgreens or CVS, and all of a sudden this $100 medication that they were paying $0 for, now the pharmacist says, Doug, you owe me $25. Well, guess what? That senior is gonna flip out. They're gonna call you, Luis, what happened? My plan is terrible. I was paying $0 and now I'm having to pay $25. Oh my God, the end of the world has just happened. Okay. Seniors, they're gonna flip out. They're gonna, it's like, oh, OMG. Okay, pretty much. So what happens, guys, when that $4,430 is used up, now they go into stage 3. Stage 3 is the coverage gap, which is known as the donut hole. Okay, here's where it gets a little technical. Okay, remember we got this $100 medication. Okay, the senior paid 25%. Okay, the carrier, the insurance company that you're using is going to pay 70% of that cost. The manufacturer of that medication is going to pay 5%. So that's a total of 100%. So the senior pays $25. The carrier pays $70. Add those two numbers up and you end up with $95. Okay. $95 goes towards meeting the hole. The size of this hole is right here, $7,050. So for this one medication, this senior probably is not going to get out of the hole. Now, Doug, there's some medications out there that cost $3,000. I know of an arthritis medication that's $3,000. Okay, 25% of that is $750. Well, if they do 10 months of that, they're going to reach the hole. They're going to surpass it. Okay. But usually a lot of seniors will never get out of the hole. And here's what I typically see, Doug. 2 things are going to happen. Okay. They're either going to cough it up and they're just going to have to roll with it. But normally what I see is this 25% is not in the senior's budget. So they stop taking the medication. And guess what? They get into that death spiral. They get into their health starts deteriorating because they're not taking their meds, and it's just not a good thing. But we can do something for these people. Okay. And I'll hit that here in a minute when I get to the last part of this stage. Okay. So seniors having to pay 25% until they reach $7,050. Once they reach that $7,050, now they go into stage 4. Stage 4 is the catastrophic stage. That's the question you were asking me, Doug. What is the catastrophic stage? The catastrophic stage means that when you reach the $7,050, you now are going to pay the greater of 5% of that medication, $3.95 for generics, or $9.85. Okay, which is greater? Well, if we assume that this is a tier 1, 5% would be $5. So it could be $3.95 because it's a generic, but you're going to pay the greater of. So you're going to now, instead of paying 25, you're going to pay $5. Okay, that's the way these 4 stages work, and they will continue working like this until it resets at the end of the year.
Okay,
so new year starts and this whole thing restarts fresh all over again.
Okay, so I think that kind of answers because the question I had is, well, if the client's got this expensive medication and 6 months in, there's, let's say they're kind of low income, maybe with a D-SNP, do the dual people have the same problem?
So great question. So how can we help seniors with the way this engine works? Well, I did mention that this engine works the same across the board with all carriers. Okay. But If a senior is a dual, so you mentioned dual. So for you new agents, a dual means that they have Medicare or Medicaid. Now, if they have Medicare and Medicaid, they will automatically have LIS. Okay, LIS stands for low income subsidy. What that is the extra help with prescription drugs. When a senior is awarded LIS, or if they have Medicaid and LIS, what it does, it wipes this away completely. Okay, this is out the door, Doug. Okay, and in fact, here's what I'm going to do. I'm going to show you what I mean by it's out the door. Give me 1 minute. It'll take me less than a minute to pull this up. Doug, is there another question you asked while I pull this up here?
You know what? Not really. Well, I was going to say, you know, if they have this problem, they're reaching this 6 months into it, maybe if they just switch to a different carrier,
Ooh.
It'll all start all over. But I'm starting to get the feeling like it won't.
You're right on the money there. It is, unfortunately, guys, it's not going to start over. So switching plans does not reset this. If that were the case, guys, we'd be switching them all year long once they hit the donut hole. In fact, there wouldn't even be a donut hole because you could switch them out. So switching is not the answer. Okay, I'm 30 seconds away from pulling up this summary of benefits for a dual plan so that we can illustrate.
So, and while you're doing that, what I wanted to bring up was, so a lot of agents ask me, you know, because we do have our lead credit program, agents that come in contract with us, they have access to Luis and to all of our training. And our lead credit program is pretty cool. You get 3 direct mail leads for every Medicare Advantage sale that you make, whether it's a brand new turning 65 or you're switching a dual client halfway through the year, what have you. So I do want to mention that because a lot of agents ask me, well, Doug, how do you get paid if, you know, you're in June and you're going to start a new client in July? So what I did was I called one of the carriers and I asked them, I said, well, I'm confused. Am I going to get advanced certain money? Do I get paid as earned? And what they explained to me is that, well, let's say you've got a client, you're starting them with a new plan that's going to start in July, which will be the last 6 months of the year. So what they're going to advance you on that first sale is what's left in that year. So it's going to be a 6-month advance. So what that means is this, and this is kind of cool. When you're doing AEP, you're sell a client a policy or an enrollment in, let's say, November, and the plan's going to start in January, you're going to be advanced that whole 12 months. But on the second year, and this is where I thought was interesting, what about renewals? Are they going to advance me on renewals? No, they pay renewals as earned. So this was something I wanted to talk to Luis about. Luis, am I right? Is this with all the carriers?
Yes. So what happens, guys, is some of y'all think, you know, Medicare is, I call Medicare slow money. Okay, not fast money like final expense money. It is very slow. Renewals come in every single month. It's mailbox money. So yes, with Medicare, guys, okay, with Medicare, when you enroll somebody new to Medicare, Doug, commissions, they're incredible. I'm gonna show you what the actual commissions are. But yes,
it's sweet, yeah.
With Medicare, you will receive lifetime commissions, guys. Not for 7 years, not for 3 years, and then they dwindle. Lifetime commissions, as long as that customer stays your customer. If they roll to another carrier with another agent, well, you lose them. But as long as they're yours, lifetime commissions. Now, check this out, Doug. I know we're in we got a little off topic, but let me just share with you. I'm gonna go back to the dual that you mentioned. Here is a summary. Here's the portion of the summary of benefits. It looks completely different than what I had before, right?
No, hold on. I'm still looking at the same screen.
Oh, I'm sorry. Okay, hold on here. I'll get to it here. Okay. Stop share. Okay, sorry. And I'm going to reshare, guys. All right. Check it out. How about now?
It's okay. Yes.
Okay. The one that I was sharing with you had stage 1, stage 2, stage 3, stage 4. Look what happened here, Doug. This is a dual. This is somebody who has Medicare and Medicaid. Remember I said that if they have Medicare, Medicaid, they automatically have LIS, and how it wipes away that whole deal? If this is the case, look what happened here, guys. There's no deductible. All drugs covered, a $0 copay.
So that's it. No, there's no donut hole for the dual people.
For the dual people. Now, this is with one carrier. While you were talking, I went ahead and pulled up a summary of benefits for a different carrier. Do you see this now, Doug?
Nope, still looking at the same thing.
Same screen. Okay, let me stop share. So I pulled up another carrier. How about now?
Yep.
Okay, so this is another DE, a dual eligible plan. Okay, and let's get into there. Sorry, guys. Okay, there we go. So with this carrier, no deductible. Okay, if you look at this, where's stage 1?
Right.
Where's stage 2? Where's stage 3 and 4? Okay, because it is a dual plan, it completely wipes that away. And here's what happens with this carrier. If it is a generic drug, depending on the drug, they may pay $0, $1 and change, $3 and change, or 15%, depending on the drug. Okay, so what I'm trying to illustrate here, guys, is that when it is a dual, or if they have LIS, the initial stages that I was sharing earlier. So these right here. I'll find it. Okay, this is that's one. Okay, let's get this one. Do you see this one now?
I do, yeah.
Okay, this is the one that I was illustrating earlier. Okay, when you have a dual client, then this completely goes away. It's a whole nother ballgame. Super, super easy. Now, for you newer agents out there, it is important. 2 things I'm gonna bring up that you have to do. Regardless of whether they have LIS, whether they're Medicaid and LIS or they don't, you have to make sure that the prescriptions are inside the formulary for this one particular plan. Okay, if we go back to the other PDF, this one right here where it says all covered drugs, there's a word, covered. Covered means drugs within the formulary. So just because everything is a 0 doesn't mean all medications, only the medications that are covered. Okay, and you can do that search with Sunfire, and you can do the search within the carrier broker site. Okay, now you mentioned one other thing. I'm going to stop sharing again. You mentioned commissions, right? I will tell you, let me pull my, I have a little chart here that I use. Check this out, guys. Okay, let's share again.
Okay.
Just so you know, Doug, we are getting a raise, okay, in our environment right now.
That's right. Yeah, I like that. Hey, who doesn't, right? We all want to raise.
Hold on. Oh, I'm running out of batteries. Sorry, guys. Hey, my prop gun kind of worked. Okay. Man, things just sometimes don't work like they should. Okay. So, guys, we're getting a raise, guys. So check it out. Okay. Look down here, depending on your state. Okay. You're in Florida, Doug. I'm in Texas. So we're going to be in this category. Next year, if they are new to Medicare, $573 initial commission for the first 12 months. After that, we will receive $287 per year for the renewal. So do some math, guys. Okay, for agents, Doug.
You know what, and the way I look at it is, you're keeping that client for life. So that 287, let's say the client already has a plan, you're moving them to something that's maybe better for them, something that maybe suits their needs more. You're getting that $287 every single year. So this is the beauty of it. Over a 10-year period, you just made $2,870 per sale. every client that stays with you for 10 years, plus another 287 for the rest of their life.
And let's do another set of math. Every 100 clients that you enroll is $28,700 in annual commissions. So our guys that go through our training program, we have guys that are writing 30 and 40 applications a month. Now, this is not during the annual enrollment. This is outside of that period. These guys will do 200 to 300 during that annual enrollment, okay, because of our lead program that you were just discussing. But let's assume that you're a 200 a month, a 200 a year guy. And let's say you work for 3 years at 200, okay? At the end of 3 years, you'll have 600 clients, assuming a perfect world. Nobody died, nobody left you. Guys, you're making 172 grand a year in renewals. That's 14K a month, and you don't have to go to work. You can go where Doug lives and go fishing. Hey, just go out there, just manage your book of clients. A senior calls you, hey, Mr. Senior, what's going on? How's life? Handle a little problem. You can't even do service work on them. You got to send them to the carrier. And oh yeah, you know what? Here's what I recommend, Mr. Senior. Get your card, turn it back to, there's a 1-800 number, call them. They'll help you. They're the only ones that can take care of it. Bam, put another shrimp on your hook and throw it out and go fish. And you're still making that $14,000 a year, 172K when you have 600 clients.
Nice.
Money is incredible.
Yeah, and I speak with Ari. I spoke with Ruben, the other day, and we're just a couple of weeks into annual enrollment, and he's already approaching like 100 new clients after I think we're like 3 weeks into this. Some of the agents can really rock this with a good lead program. And
I'm going to add to that, Doug. I know you're a final expense trainer. Your final expense guys that are not doing this, you guys need to get a hold of Doug and say, Doug, I need Medicare contracts, because those same leads you can transition compliantly to Medicare. Doug,
exactly.
Would you ask me how?
How?
Okay.
There you go. There you
Okay.
go.
You can do that. You can wear a Ask Me About Medicare button. I have a smart book that our agents get, Doug, that I, on all my appointments, regardless of what I'm doing, I have that smart book out and it has Medicare. Like, oh, Medicare? Seniors want to talk about Medicare. They want to get all their entitlements, dental, vision, hearing. I'm sure all of you have seen Joe Namath talk about all these extras that seniors can get. Believe me, they want it. Okay, so all of your final expense agents, Doug, that are not doing this, that are buying leads right now, you can transition compliantly to them. Okay.
Beautiful.
Also, if they're your customer, you don't even have to wear that mask. You can just call them up. Hey, Doug, how's your final expense policy treating you? Hey, by the way, I'm in the Medicare space now. So here's what I'm going to do. Doug, can I come over tomorrow? Okay, I'm gonna talk to you. I want to do a Medicare review. Let's make sure that you're in the best plan. I can be there tomorrow at 9 o'clock. I didn't ask him if I did the assumptive close. Sure, come on over. Okay, man, put some bacon on there. Put some bacon in. I'll be there for breakfast and some coffee. I'll be ready to go.
All right, I got just a couple more questions for you.
Let's do it. I get excited about Medicare.
Hey, this is awesome. I can't believe we didn't, all the years of selling final expense that we walked away from, hundreds of that, probably potentially over $1 million we walked away from. Okay. What's the difference between AEP and OEP?
Okay. AEP is the season that we're in right now. AEP is called the annual election period. Now, during this season, which started...
I was going to say, please give us the dates.
For sure. So the season started October the 15th, and it will end on December the 7th. This season allows seniors to either enter Medicare, the Medicare Advantage world if they are not in it, It also allows them to make plan changes. Okay, look at your TV. Okay, I know a lot of us work, but if you go turn your TV on right now, you will be inundated with commercials from every carrier out there. Okay, so it's a time of the year to do enrollments. Now, after December the 7th, we're going to have a cooling off period. Okay, so from the 7th and the 8th to the end of the year, there's not much that you can do. And then the first quarter of the year, you will have OEP, open enrollment. This allows every senior in the country to make one final change, assuming they're unhappy with their plan. So if they, let's assume that they're with this carrier, but after seeing their doctor and maybe the specialist doesn't take it, or whatever the reason, if they don't like it, they can make one final move to a different carrier.
Or if they didn't make the switch, in other words, they've had a plan for a couple of years, and now here they are in February. Well, they can make the switch, correct?
If they have a plan, so they can't upgrade, they can do a lateral move or a downgrade. So they can go from one Advantage plan to another. So let's just say they missed the annual enrollment, but they find out from their buddy, hey, that this other plan is great, and they want to try it, then they can make that move too. Okay. Or let's say they're like, you know what? I'm done with this Advantage plan. I want to go into the Med Sup world and I want to get a prescription drug plan. Great. We can take them off the Advantage plan, enroll them into a prescription drug plan, and then put them into a Medicare supplement, assuming, this senior doesn't have any guaranteed issue on this Med Sup, so they're going to have to go through underwriting. So assuming that happens, you can make that move during OEP.
Okay, beautiful. Now,
and Doug, I got one question that you asked that I haven't answered, man. So you hit me up with the catastrophic coverage question and the maximum out-of-pocket question. So I hope I answered, and I know I did. I answered the catastrophic question. It is tied to the prescription side of things. Now let's dive a little bit into the maximum out-of-pocket. So share, and I'm going to share. Let's go here, and I'm going to close. Let's open up. Okay, here we go. All right. So in a summary of benefits, Doug, and every carrier has one.
I'm still seeing the commissions.
Oh, okay. Page. Sorry. Let me stop sharing. How about now?
Yep.
Okay, perfect. So every carrier in their summary of benefits is going to have this maximum out-of-pocket amount. You'll see here does not include prescription drugs. So you don't take the prescription side of things and embed that into this number. So you mentioned, Doug, 6,400, you mentioned 3,900, 3,500. Every carrier is going to have a out-of-pocket limit, and they're going to vary. This carrier right here has 3,900. Okay. What this means is $3,900 annually for Medicare covered expenses you, Mr. Senior, receive from in-network providers. This is the most that you will pay. Okay. If you reach the limit, then you will not pay any more for the remainder of that year. So just to give you an idea, okay, let's say here's an inpatient hospital. You're in the hospital and you pay $100 a day for 5 days. And let's say you're in there for 4 days. So you spend $400. Okay. $400 goes towards that $3,900 limit. So you've now reduced it to $35. Okay. Let's say that you go to the emergency room. You spend $90. Okay. All these medical costs that the senior is having to pay is going towards meeting that maximum out of pocket. Once you've met it, you're done for the year. So that's the difference between the catastrophic coverage on the prescription side of things and the maximum out of pocket on the medical side of things.
Okay. All right. So that brings up a question I think is kind of important. And I got to ask you this. So you got Mr. and Mrs. Client, let's say Mr. Jones, he's making $20,000 a year. That's just not much. That's not LIS numbers. That's a lot more for whatever reason, but it's just not much. You know, he's making $400 or $500 a week. That's what he's surviving off of. And all of a sudden he gets this bill from, I guess it would come from Humana, you know, from about the medication for whatever, $2,500. And he don't have that kind of money. Can Medicare cut him off or Humana cut him off? Do you know how that works?
I do. So what happens there is, let's assume it's $3,900. And now Medicare, looking at the summary benefits, we know it's $100 a day for 5 days. So let's say the senior goes into a in-network hospital and they're there for 2 months. Well, they're only going to owe $500. That $500 is owed to the facility, not to Humana or United or the carrier. So they're going to have to make payment arrangements with that facility to pay that money owed. Usually they will handle all that beforehand if it's a scheduled event. Okay, if it's an emergency, well, they're going to admit them and then they'll get their bill and that senior will have to figure it out. But if they are a dual, they don't have to worry about it. If they have Medicare and Medicaid, those per day copays for the hospital, the copays for doctors and meds and ER on a dual, somebody who has Medicare and Medicaid, all the medical services are at a $0 copay. Okay. In our world, guys, it's not free. In our world, $0 copay. Yes, it means it's free, but don't ever use the word free in our world. It's a $0 copay. The other thing, here's the other thing that's important. Now, I tell agents, we talk about package selling all the time, okay? And we want to package sell when we're in a compliant environment. And this goes back to your question of how can we help these seniors with these bills? Now, in my area here in San Antonio, Doug, I'll go ask a lady, you know, let's assume it's $100 a day for 5 days. So she's in the hospital for a month. She's going to have to owe $500. I'll ask her, you know, ma'am, do you have $500 in your account? And my people are Spanish speakers. She'll say, mijito, I barely have $5 in my account. Mijito means son. And she's, at the end of the month, I have no money. I don't know how I'm going to pay this. Okay, check it out. You can compliantly offer seniors. I do this on every plan. Okay, so I'm going to screen share one more time. Okay, check this out. So this is what I do, guys. So I'm sitting with my senior and I'm going to tell him, you know, Mr. Senior, hey, Doug. So when you're in the hospital, you're going to have to pay the facility $100 a day. And guys, this is a free pro tip. Okay. So pay attention here, guys. You should be like this on your speaker right now. Okay. So $100 a day for 5 days. Doug, remind me at the end of this conversation to tell you how I can take care of this for you. Okay. I go on and I continue explaining. Hey, Doug, let's assume you have an emergency. I call the ambulance. Okay. Ambulance comes and picks me up. Let's see how much the ambulance costs. Ambulance, $270 copay. So Doug, the ambulance picks you up. Doug, where does the ambulance usually take you?
Hospital, emergency room.
Exactly. What specific part of the hospital? The ER. Okay. So you owe them $270. Okay. And then let's go to the ER, which is up here. Emergency room, $90 copay. If you're admitted into the hospital, they waive this, but let's just throw it in the mix, $90. So Doug, at the end of this meeting, remind me how I'm going to help you with the hospital copay. Remind me how I'm going to help you with the emergency room copay, and remind me how I'm going to help you with a portion of the ambulance copay. So I continue and I explain the entire summary of benefits. I make sure I check all my doctors. I check all the meds for my senior. I make sure this is the best possible plan for them, and I enroll them. And then, Doug, this is sales skills, guys. Get ready. Doug, wasn't there something we were going to talk about? And I play stupid. I'm like, there was something I was going to do for you, Doug. Oh, do you remember? And then, Doug, what should you say, Doug?
Well, how can you help me to take care of these copays?
Yes, Doug, that's right. Oh, I'm so dumb. Okay, yes, let me help you. Let me tell you. Okay, so I'm going to go into, and I already have this already pre-planned. I know Doug is 65. He's not 65, but he's my senior, playing my senior. And so Doug, to handle those 3 copays, I have a plan that's called a hospital indemnity plan. And this plan is going to cost you $11 and change a month. Would you like that to come out of your checking account, or would you prefer that it come out of a credit card? And what date of the month do you want it to come out?
Perfect. I love
Boom.
it.
Bam.
$11, and that's going to cover all this.
It's going to cover those 3 things. Okay. Now I do upsell. Remember, I'm a salesman, Doug. You know, I keep telling people I got 3 kids and they're wanting me to buy all this stuff. Christmas is coming. Okay. Now, when I write Medicare plans during AP, I'm not going to get paid until January. I need money right now, Doug. I got to buy Christmas presents for my little ones. My wife wants new toys, or she likes purses and that kind of stuff. My kids want toys. I need money now. Okay. Hospital indemnity plans are going to pay out in less than a week. Okay. Now on an $11 premium, I'm not going to make a killing, but still, if I'm writing 200 or 300 of these, it's going to add up, and there's renewals on this. Okay. Now I upsell when I do these hospital indemnity plans, and we can do a different video, but I add cancer. Okay. What you guys don't know, this is another pro tip. Let's go to cancer. Therapeutic radiology, guys. That's chemo. $60 copay. Most carriers charge 20%. This carrier charges 60. Okay, chemo, you got to knock out numerous treatments. It's not a one-time and hope it's done kind of deal. How are they going to come up with this money? So I upsell my hospital indemnity, and I will add $10,000 of cancer. Now my premium is in the 40s. Okay. Sometimes you got to think, guys, these people may be retiring from a group plan and they're used to paying $500, $600, $700. Now they're coming into Medicare. They have to pay their Part B premium of $148. This plan has no premium. Why am I going to leave money on the table? Offer them a $10,000 cancer plan, maybe a $20,000 cancer plan built into that indemnity plan. So Doug, upon diagnosis of cancer, okay, life-threatening, melanoma is not going to count. You're going to get a smaller percentage for this, but life-threatening cancer, we're going to write you a check for this amount. Now you can take that money, Doug, help meet all your copays. You're going to need that anti-nausea medication that's not cheap. Maybe you want to go get treatment that's not approved by Medicare in Europe, the latest cutting edge treatment, or in Canada. Medicare's not going to pay for that. Okay. Or maybe, unfortunately, maybe you can't beat this and you want to take that one final trip with your family. You want to treat them, or you beat it and you want to take that I beat this thing trip, and you want to take your spouse. Or maybe you want to use the money. Hey, I don't want my spouse to work. I just went and got chemo. I feel like crap. You know, maybe the spouse wants to stay at home and take care of you, but you still got bills. Those aren't going to stop, Doug. So you've got these scenarios that you have to create and offer to your senior. What's the worst thing that a senior can tell you on this, Doug?
No, that's it. Nope, can't do it.
Okay, no means not now, but I'm going to look at it. No. Okay. What about this? What if instead of 10,000, we do 5,000 and I give them that new premium? So instead of it being 40, could you maybe do 30? No, not quite. How about 25? Okay. And I'll play with it and I'll get it to where they're comfortable. Nice. Or they just say, nope, I don't want cancer. Then I'll just offer the $11 plan and I'll rock and roll. That's nice. A huge pro tip. That's a cross-selling, and you can do it compliantly because it's on the scope of appointment, Doug.
Awesome, Luis. Yeah, that's some good stuff, man.
We're helping our agents.
Wow. I feel bad for anybody who didn't stick around to the end of the video. So one last thing I want to ask for us new agents that work in all these, like my wife and I, we've got clients throughout like 5 or 6 different counties, and all these plans There's so many plans that it's impossible. I mean, we started putting them on a spreadsheet and then realized we had to do a spreadsheet for every county, and it's just a lot. So for someone in my situation, what would you suggest just to make life super easy?
So new agents, guys, here's what I would do. There are, in my county, I think there's 39 plans in my county. And you're talking about multiple counties, okay? I'm a smart guy, Doug, but I even have trouble keeping up with plans outside of my county, okay? It is a challenge, and I've been doing this for 20 plus years. So here's what I would recommend. Pick 3 carriers. Pick the big boys, maybe United, Humana, Aetna. That's what I use. You can go pick WellCare. Find the plans that are hot in your area and learn them and just stick to those. Okay, what you have to learn, agents, is if somebody tells you they have this plan, how are you going to beat it with this plan? Okay, they're not all the same. Okay, you have to know how to fight. So if they have United, okay, you need to know what your other 2, how they're much better than United. Okay, and vice versa. How are you going to get that intel? Well, I have a spreadsheet template that I've shared with agents that will be glad to share with you. Just hit Doug up and he can give it to you. But I have all these on the spreadsheet, and I'll just do a little quickie share of it right now.
Beautiful. Yeah, please do that.
Just so you guys can see it. All right, here it is. All right, here's my spreadsheet, guys. So I have different sheets here for my core plans, which are my regular plans, my dual plans, my chronic plans, and my PPO plans. And I have not all the benefits, but I have the ones that I talk to my seniors about. So if they have United, I have all the goodies here. Well, check it out, guys. How can I beat United just looking at my chart? It might be a little hard for you to see, but United charges $100 a day for 7 days. Well, Humana only charges 5 days. I'm going to exploit that. Okay. Maybe they have an Aetna plan. Well, look at Aetna's maximum out of pocket. Okay. They're $4,500. Humana and United are $3,900. I'm going to exploit that. Okay. Look at the dental benefits. Look at the vision benefits. You need to know how to beat the different plans. You need to know how to fight, guys. So I like using this little spreadsheet because that's how I cheat. Okay, I cannot keep all these plans in my head. So it's a very easy thing to utilize so that you can compare and not having to do all the research where you're sitting there in front of your senior. So it's a great, great tool. So I would say 3 plans, know them inside and out. And here's another pro tip. Man, hope we still got agents on this video. Pro tip number 3, I think. Guys, what you want to do is call your local rep. Hey, invite that he or she to a cup of coffee. Okay. Hey, Mr. Representative Carrier, I want your plan to be my #1 carrier, but how do I compete with the other ones? They're going to give you that insight that I can as your trainer. Okay. I don't know the plans out there in your area. So you're going to have to get with that account executive and he'll give you all the insight. He's going to tell you the weaknesses of the other plans and the strengths of his. And then you go do the very same thing with the next carrier and the next carrier. That way you can get all that juicy intel that takes years to get. You can get it with a cup of coffee. So wow. That's what I would recommend.
Luis, okay. Man, I can't thank you enough. This has been just awesome, bro. And guys, agents, you guys know how to reach me. If you have any questions or you need anything, I'll put my email addresses linked in the description. Luis, do you have anything else?
I have one more thing. I always have one more thing. Okay, one more thing. So guys, if you're not happy where you're at, okay, or if you're thinking about getting into the business, I am not a recruiter. Okay, I'm a trainer, guys. You got to get a hold of Doug. Yeah, there we go. Pointing the right way. Get a hold of Doug. Okay. He'll get you set up with contracts. Now, when you contract with your Doug, you get me. Okay. I am the trainer, guys. And I'm going to just go over a couple of things that we do for our agents when they contract with us. Okay. If you already have contracts, you got to wait, go sell, go make a living, go do your thing. And in January, you can get with Doug and we'll move them over to us. If you're new, we can get you set up now. Now, what you're going to get with us, because a lot of entities out there, Doug, are great contracting entities. They will contract you, and then they're going to do one thing. They're going to push you into the pool. Okay. Either you're going to sink and drown or you're going to swim. And most agents are going to sink and drown. Okay. This is not an easy thing to grasp. All right. That's what happened to me. Okay. I've been doing this for 20 years. So we are a little bit different. We're a lot different. Screw that little bit. We're a lot different. Okay. Here's what we do, guys. So number one, every Tuesday and Thursday, I have Zoom trainings. Tuesdays are sales and marketing trainings. Thursdays are Medicare 101 for our new agents. You're going to get access to that. We have a chat room. Guys, I know you're agents from all over the country, and sometimes you feel like you're on an island all by yourself. You got no friends, no colleagues. Well, you know what? Our chat room is the best thing that we can do where you can collaborate and communicate with other agents. I think we're getting close to 500 agents in this chat room alone. And I tell agents, that's where you want to go in there and ask questions, post your ideas. Hey guys, what do you think about this? And we tell agents, hey, introduce yourself. Hey, I'm in this city. Are there any agents here? And surprisingly, you will find other colleagues out there. Okay, chat room, the Zoom trainings, and then here's the grand finale. Okay, and I tell agents, you got to respect me a little bit, and only respect me in this sense. Okay, if it is not a time-sensitive question, we want you to post it on the chat room. Okay, now if you're in front of a client, Doug, I do not want you to lose that sale. This is where I want you to pick up the phone, text me, call me, Luis, I am with Mr. Smith here, and we are stuck. I don't know how to I need you to unstuck me. Can you help me out? That's where I want that call or that text message. Other than that, got to be respectful of my time because we are helping lots of agents. I want you to post your question in the chat room. But that's what we're coming to the table with, guys. Unless I'm on vacation, I am available. During this annual enrollment season, I got guys calling me at 10, 11 o'clock at night. I don't care. My job is to help unstuck you. Okay. So that's what we're coming to the table with. I know there's entities out there that I would say 90% of them aren't doing that. They may have some videos and say, go watch them. Good luck. And that may work for some people, but we want to train our agents well. We want them to be successful because we're not going to be successful unless you guys are. So that's what we're coming to the table with when you contract through us. So if you want contracts and you want to move, get a hold of Doug. He'll set you up with that.
Beautiful, beautiful. And guys, that's basically it. So just remember, when you put the needs of your clients first, everything else will usually fall right into place. So get your butt out there and do something good for someone today. Happy hunting. Beautiful. Thank you, sir.
That was a great one, man. God,
that was good. A lot of information. Holy cow.
I mean, here's what I would do. Maybe post the whole thing, but I mean, you're more the YouTube guy.
I'll edit some of it. Yeah.
But
I'll edit some of the dead spots out for sure.
Yeah. Well, some, I mean, you can break this up and then put those out there too.
Yep.
Yeah.
And I'm going to work on the ACA one today and tomorrow. It'll be out this weekend. Perfect. So that video is going to come out immediately.
Okay. Cool, man. Cool.
All right, brother. Hey, I got a carrier trip. We're going to Hawaii on Friday, man. So we'll see you next week, dude.
Hey, man, have fun, dude. You going fishing?
No, I won't be fishing in Hawaii.
No, man. How cool, man. Which carrier is it?
It's Security National Life.
Oh, yeah. Super cool, man. Well, have fun, dude. I love carrier trips, man.
Yep.
Next time your wife don't want to go, man, just call me. I'll go with you, bro.
Okay. That sounds good. You're right. That'll happen.
Yeah, I'm sure. Exactly, man. All right. Take care.
All right, bro. Thanks.
All right. Bye.